This presentation, entitled Research Results We'd Like to See, Protocols for Proposed Clinical Research Projects, was composed by Bob Demers. At one time or another, we've all swapped a mouthpiece for a mask when attempting to deliver an aerosolized bronchodilator to a patient. Do you have any idea whether this has any effect, favorable or detrimental, on the dose that is delivered to the patient's lungs? And if you have a hunch about the relative efficacy of a mask versus a mouthpiece, can you cite any evidence to support your claim? This module will provide you with reliable data that addresses this question. We've all been bombarded with the claims of various manufacturers of airway clearance devices, each promising that the device which she or he is peddling is superior to all others. How might clinical researchers, such as you perhaps, determine whether these claims are either sound or pure hype? Various researchers, some of whom are RCPs, have developed research methodologies that could profitably be applied to evaluate the performance of airway clearance devices accurately and unequivocally. Handheld nebulizers, or HHNs, are devices familiar to every RCP. Just how effective are these pneumatic units anyway? After you are shown the highly accurate performance data obtained through the use of radioactive tracers, you may be shocked to learn how profoundly ineffective most of these devices really are. If we learn that a particular brand and model of nebulizer in use in our department actually is there anything that we might do to enhance the efficacy of the all too familiar med-neb treatment? Navigate through this module to learn that the answer is a resounding yes. Then consider undertaking the protocols summarized herein to generate data that can be used by your RCP colleagues everywhere. Virtually all RCPs are called upon to perform a peak negative pressure, or PNP, procedure for an intubated patient who's a candidate for extubation. What morphologic changes occur during the performance of a PNP, and how might those changes predispose a patient to a subsequent failed extubation? Is it possible that in the process of undertaking a procedure designed to facilitate extubation, that we might actually be placing that patient at risk of aspiration? The answers to all of these queries are supplied in this 53-minute module, and the scientific analysis that forms the basis of each is clearly explained. If you or any of your coworkers would like to undertake a meaningful clinical research project, you owe it to yourself to navigate through this module. Who knows, your interest and efforts might culminate in the generation of important advancements in the clinical practice of respiratory care from which we would all benefit.